Welcome to the Dentist Show. Let's jump right in.
Well, welcome to the Dentist Show.
The Dentist Show.
We are on. It's opening week of college football.
Is that why you have the Ohio State sweater on?
I guess it's backwards. Yep, that's the Ohio State. They open with Texas. So the national champions play in Texas. Should be a good game. So hopefully you guys are watching on Saturday.
Yeah.
I know you are.
I'm a huge football fan.
Yeah.
You have no idea.
I
didn't even know football started yet.
It starts Saturday.
Saturday.
Well, it's technically next Saturday, but this will drop after. I was talking to somebody that played at Eastern Washington, played basketball. And I was like, I know where that's at. Yeah. We talked about Moscow and Pullman.
Yeah, you've been here.
I've been. I haven't been to Moscow, Buckeyes.
No, but you've
Pullman.
been to Eastern Washington.
Yeah. So we talked about it, and he's like, because it is odd that there's University of Idaho and Eastern Washington right by each other, and he said there's literally nothing out there. It's two universities. It's like,
WSU and University of Idaho are like in the rolling hills of the Palouse, and so there's wheat fields, and like high schools that have like 50 people in them, and then major like schools, like big 50,000 plus people schools.
Yeah, it's so weird. Oh yeah, it's Washington State that's in Pullman, huh?
Yeah, WSU.
Eastern is in Spokane.
Eastern's in Cheney, which if you go to Cheney, there's 6,000 people that live in Cheney full time, or maybe 10,000, but
right. Yeah, it's small, but
it's not big.
Yeah, that's right. He played for Washington State. He lived in Pullman.
Okay,
but anyway,
yeah, I think Eastern actually has more students than people that live full time in Cheney.
And that's where you went to school, was Eastern.
That's where I went to school. Yeah, and it's only like 12,000 person school. It's not a big school.
Well, hopefully everybody gets to watch some college football this weekend, cheer on the Buckeyes, and watch them destroy the Texas Longhorns. Be a good day. It's weird being out on the West Coast because their Ohio State home games start at noon. And so it's 9 a.m. our time. So
that's crazy. I didn't even think about that. You gotta like wake up, get your popcorn.
You're eating pancakes and watching the game. Right eating. What do we have? Well, I used to love Fruity Pebbles. Yeah, Fruity Pebbles and watching football. Not eating wings or ribs. You're eating cereal.
Yeah, it's funny. It's true. I saw in your pantry you have Fruity Pebbles. Like that's your guys' cereal.
That's my cereal. I used to love that thing. It was like crack. Do you guys like fruit? Do you like Fruity Pebbles?
Dude, I haven't eaten cereal in years.
Well, me neither, but it's in there.
Yeah, except for college football.
Well, I take that back. I did have a bowl like a couple weeks ago.
Yeah. I think you made a comment on one of our podcasts on how eating a bowl of cereal is like eating a whole loaf of bread or something.
Oh, really? I can't
remember what you said.
It's so much sugar. It's crazy. Plus, like, our kids still drink vitamin D milk, so it's like fat and sugar plus sugar. Yeah. It's good.
It's good.
So
tasty.
It's like donuts, man. And nothing tastes better than carbs and fat combined.
Oh yeah, it's like that right there is life. And that's why your brain, it's like, hit me again.
I like that. Even though I'm going to throw up, hit me again.
Yeah, actually, that's the worst part now. Like I'm not healthy by any means. I'm overweight for sure. But because we've been eating a lot more protein and a lot less like processed sugars and things, when I eat a donut, because I still have a donut from time to time, it makes me like get all spun out almost and like feel sick because so much sugar in one sitting.
Yeah, it's happened before. We were talking about that today. Someone brought in Krispy Kreme donuts, and then somebody else brought in the fancy donuts, kind of like voodoo donuts.
Voodoo, yeah.
It's not them, something similar. And I was saying every time I had one of those voodoo donuts, dude, they're like so sugary. I don't like them. They like crank up the sugar.
It's too much.
Just give me a regular apple fritter
we have a local place called. Well, it got renamed. I can't remember what the new name is. Someone bought it, but it's Scrumdiddlyumptious. And like each donut's like this freaking big. It's like the local voodoo here.
Yeah.
And you freaking just bite one bite into that thing, and you're like, shh.
Like so much, dude. I don't even like the flavor.
It makes your gums tingle and like your lips tingle, and
it's so much sugar. I don't really like the taste of that much sugar. I need a little more fat, I think.
Yeah.
So,
I'm a savory guy. Like you give
me
me,
too.
like I'll take like beef stick over candy or sugar probably any day.
yeah, most of the time. Depends. But yeah.
Most of it, yeah. A bag of potato chips though.
Dude, that's my weak,
Good
that's my
old
weak
bag
point.
of tater chips.
I
with,
don't think there's anything better than a
Well, I'm a big fan of salt and vinegar chips. Like,
dude, they're awesome. Or
like good old bag. What are they? Cascade, the the crunchy.
yeah, something like
We
that.
have them up here. They're Cascades because we live in the Cascades. But there's, I forget. They're like kettle.
Yeah, kettle.
Kettle
kettle
cooked
chips. I don't know.
Yeah.
I like those too. Although, I mean, there are not very many chips I do not like. I mean,
You're a chip guy all the way.
dude,
through.
I am such a chip guy. There's nothing that tastes better than chips, especially when you're doing like a really strict diet.
Yeah.
And then you like see
You like
some
sneak
Doritos.
one chip.
Yeah, dude, it's like it's straight up crack. Like Doritos or Sun Chips or salt and vinegar chips.
They figured it out. They got it dialed in.
They definitely have. Well, so on this,
Yeah.
on
What are we here to talk about besides
make me hungry for some chips. Give me some sun chips right now. Dude, I had a patient today that was complaining. I was in the room. We're seating a bridge. And they're like, okay, we need to take an x-ray of it. And she just starts complaining about, every time you put the sensor in my mouth, it cuts me all up. And I was like, sometimes I just want to smack you. This is driving me crazy today. I don't know why. like, oh my God.
It's like
enough.
It's hard. Like, so like you've given injections to those patients that like start screaming or making weird audible noises. Like I shouldn't say on a podcast because people are thinking I'm making a other adult film in here.
Right.
But it's like, why are you acting like this? You're a grown ass adult. Like, suck it up like everybody else does.
Right.
Like, I have like 99% of my patients don't say anything, and they're like, "Well, that sucked, doc." And I'm like, "Yeah, it does." And then there's you who like moans and screams, and I have to close doors to get you done.
To not to scare other patients.
Yeah,
dude, that's like. They don't make our job any easier. They just moaning or complaining, and you're like, seriously, you're like 40.
Yeah, or
is
like
this the worst pain you've ever felt.
It's always the toughest, biggest dude that just that's like, and you want to know what it is? It's the people that won't take ownership over their own like situation.
Here you go. Here goes Ryan going all in on ownership
like,
because
I'm
of
going to lecture here on this podcast. No, I'm thinking of one patient in particular that every time I get him numb, he just is the biggest baby. And then every time he comes in, it's something else's problem or fault is why he's in pain, or why his teeth are the way they are, or why his denture doesn't quite fit yet. It's always someone else's fault or something else's fault. And I'm like, no, dude, you're in this mess because you created it for yourself.
Sounds like a Democrat. Can I say that on the podcast?
I
don't know. We probably just got canceled.
I am not directly affiliated with Chase, nor do I have the same beliefs. Or not just
actually, you're way far more to the right.
Yeah. I live in like northern Idaho, dude. You're either with the Klan or you're out. Like,
dude, sometimes those patients just drive me crazy, and I only see them one day a week now. So it's a lot less.
That's probably why it's worse. You're not accustomed to like dealing with it.
They're
so
constant.
It just really riles you up on one day. Like, I only have to do this one day. Like,
I gotta take an X-ray. Like get over it.
I'm pretty sure you told me, was it last week or the week before? Like your favorite day of the week is Monday at 5 p.m.
Yeah, it is. It's actually I have a little grin leaving work. I'm like, I don't have to see another patient for 7 more days or 6.5 days. Whatever.
Yeah, engine change, right?
Yeah. Yep. And then they'll like schedule something on my schedule in another office. But I definitely enjoy Monday evenings. Most doctors hate Sunday nights, and it's like, yeah, but Monday night's only 24 hours away. So
yeah, you can get through it. You can do anything for 24 hours.
That's right. Sometimes at lunchtime, I'm like, I got 4 hours. And I'm like, yeah, Ryan has 4 days. So I can make 4 hours.
Like, I can do this. I got it. I don't know though. We got a new doc hired, starting in Hayden, so
you might be down to 3.
I might be able to be down to 3, and then able
3 is
to
a
go
good
actually
day.
look at the medical lake office one day a week.
3 is a good number. I think 3 is pretty good, and then 2 gets a little better.
I think it's solid. So yeah. What are some things that if you could tell a patient, what would you say? Things you shouldn't say to a patient and you want to.
Dude, I walked in today and Juan's like, I swear he said, she's doing pretty good. She only brushes once a month. And I was like, wait, how old are you? Like, I'm 32. I'm like, did he just say you only brush your teeth once a month? And she's like, wait, what? No, I only floss once a month. I'm like, oh, no. All right. Yeah. That's pretty good, actually.
Yeah, statistically speaking, that's better than most.
Yeah, you're like top 1% of the world right there. That's one. I think that the one that drives me a little crazy, and I totally understand because my tooth does this too, but after a root canal, they'll come back and whatever for a checkup, and they're like, no, it feels great. Unless I like tap on my tooth. Then it hurts. I'm like, sweet. Stop. What happens if you don't?
On your tooth.
Yeah. What happens if you don't tap?
Like,
no, I know, but if I tap on it, I'm like,
my tooth hurts really bad when I hit it with this.
Yeah. That's when it always gets on my nerves because I try to explain it to them, and it's like, yeah, but like you tell them what's happening, and they're like, yeah, but I've tapped on it, hurts. I'm like, I know, I told you why. Like, just stop tapping it. I'll go ahead and so on. Mine did the same thing after root canal. It's fine.
You know, the best thing is when a patient, you do an extraction for them, right? And then they call the next day wondering why they're in pain. and it's like so many things go through my head. Yeah. Like, are you this dense?
Right.
1.
Yeah.
2, like, do you not understand what an extraction is? And 3, it's like, why do you think I got you numb to do it in the first place? Like, because it was going to feel good?
Yeah.
But I have found myself doing this in a very respectful way, or at least it sounds respectful to me when I say it. But when patients come in like next day or like within 2 days after, and like, I'm still in pain, I don't know what's going on, this and that, I literally like say to them, I'm like, if someone were to cut your finger off, would that hurt?
Yeah.
And they're like, yeah. And I'm like, would you anticipate it would hurt for at least a week or more?
Right.
And they're like, yeah. I'm like, I pulled basically a bone out of your face yesterday. Right. like it's going to hurt for a minute.
Yeah. That's just part of the deal.
Yeah. It's just part of the deal. So what do I wish I could say to patients more is like, I ripped a bone out of your face. Well, not even a bone, harder than a bone out of your face.
Right.
It's going to hurt.
It's going to hurt.
It's going to hurt.
Everyone's
like
made us feel guilty
that
to give you pain meds. So we're not going to do that now.
Yeah.
And then you can complain more. So
then you can complain more. Well, then I literally grabbed a drill and I cut into your tooth and your bone to get this thing out. Yeah. It's going to hurt.
That's funny. I don't have that too often.
Yeah. Maybe they're just big babies up here in Spokane or something. I don't know.
I mean, it's that blue blood.
Yeah. The blue blood. You're on a roll, dude. You're getting canceled today.
Good reason to shut down the podcast.
Yeah. We were just talking about how there's a lot more work to have a podcast than you think. Like every week we gotta record.
Yeah, seriously.
And it's fun. We enjoy it.
The other one, we had a patient leave. This one drives me crazy too, because they had to fill out their medical history, and they got all mad, so they got up and left. It's like, where are you going to go? Like,
no one else is going to see you without your meds,
right? Or a patient's get mad, like you're taking their blood pressure, and there's some that get so pissed. And it's like, what do you obviously don't want to do this for fun. Like our board requires it, our malpractice requires it, and we care for you, so we want to do it. And it's like, why would he get so upset about, you guys just don't know how to do it? I'm like, well, we just slap a little computer on your arm and take it, you know?
Yeah, we just hit go and it gives us a number. Like,
it's always high. Like, that is always high, but it tells us if it's really, really high.
Yeah.
That one gets me.
Or we've had people that have left us bad reviews because we had them fill out medical history. like you took the time. Oh, first of all, you complained about filling out the medical history, and then you took the time to leave us a bad review about filling out your medical history.
Right. And we make it as simple as possible. Like you can do it
yeah,
at home
like-
in your own bathroom. You can do it with us. We'll do it for you. Like we'll do anything to make it easier because we know it's stupid. And it's so easy. Like you hit no on everything and circle the one that you do apply it to. Like, are you a Democrat? Yes. Oh. You can go see someone else's practice. Like Marshall style.
Skip boxes 2 through 14 and go to the end. Oh, you are now dismissed.
I'm actually not that big a Republican, but I thought Ryan.
No, I was gonna say you're way more like middle ground than
Yeah.
I think I am.
Yeah,
Like,
it's more of the politically correct stuff that drives me crazy. But
yeah, getting canceled and like the Karens of the world, right?
yeah, that's right. What the other one that I have lost patience for, or I want to say mean things back to him, is when they say like their lower denture, and that, one of the reasons I really don't offer them anymore. But they're like, my lower denture doesn't work, and it's like, well, I kind of told you, it's a piece of plastic resting on your gums and you're chewing on it. Like, what's your expectation here?
Chucking plastic in there that's semi fit to your mouth.
And then all the response is always like, well, my mom never had a problem, or my dad never had a problem, or my grandpa never had a problem. I'm like, dude, guaranteed they had problems.
They
with their lower
did.
denture.
They just didn't complain to you.
Yeah, they weren't little complainers.
Yeah, they were little complain. What were we gonna say?
Yeah.
This is an R-rated podcast, I think.
It's not complainers like these youngins these days. They don't know how to deal with pain.
Yeah. It's it's like, remember the conversation that we had about like, hey, when we remove all these teeth, the lower denture is going to move around. Maybe we look at doing some implants down here so that doesn't happen. And they're like, that's too much. We'll just go with the denture. I'm like, okay. And it's not going to stay in place because it doesn't have implants to hold it.
The best sell tactic I have with that is I literally tell them, this will be like removing your arm and me putting a piece of plastic back in its place and having
Kinda
the
like
same
the cutting off the
expectation.
finger situation.
Yeah, just more drastic because it's a whole arm. You have a piece
arm.
of plastic flapping. That's what I do.
I like that.
They really drive it home. Like, this is a piece of plastic resting on your gums. It's not going to function at all.
Yeah.
So, anyways,
That's a good. Hey, I might try that.
I try that. Just getting there, like you're flopping.
Yeah,
Like,
you gotta really sell
gotta
it,
sell
right?
it. Sell it so they understand what's happening.
That's
So
funny.
we also got a bad review the other day. A patient came in and we could have handled it probably better. By the hygienist could have probably helped out, but she showed up like 15 or 17 minutes late or 18 minutes late to her 60-minute appointment, which really is 50 minutes because they flipped the
Right,
room
you gotta
around.
clean the room and flip it.
And so I guess that day the hygienist had to leave on time. This was the last patient of the day or something, and they said no, they can't see her. She flipped out. Like, long-term patient of mine. I mean, been seeing this for 10 years.
Yeah.
She was so late they wouldn't see her. I think they had her do X-rays because she didn't do them last time or whatever, and exam, whatever. I get it, but
Yeah,
dude.
did some things and
Yeah, so she got all mad. She yelled at everybody. Go left reviews on like Google and Yelp. It's like, dude, you're like 20 minutes late. What?
Yeah.
Your appointment's only like another 20 minutes.
Yeah.
So, anyways, those patients are rough.
they are rough. I'm trying to think of what other things like I've really wanted to say to patients.
I have plenty.
To keep them
I like the
coming.
one I had one yesterday or last week. I took his tooth out today, but his number 1. He broke the mesial margin, the front of the tooth,
Yeah.
and a doctor did a filling. And so I saw him and said, hey, I have a food cap here, or a food trap. And I said, oh, it looks like that tooth moved. And he's like, oh, no, that gap's been there since he did the filling. And you look in, the filling's like perfectly shaped like the contact. It's just a millimeter back. I'm like, dude, I don't even, like, no. He says, oh, you call me a liar? I'm like, yeah, because I can see the anatomy. I'm a freaking dentist. He did it. The teeth move sometimes. Like, relax, bro. Anyways, I took the tooth out for free form because it was number one. I don't know why we restored it anyways, but
You're a nice guy.
anyways, that one gets me. Or it happens a lot with implants. I had a patient a few months ago. We implant like 4 years ago. Obviously, it was tight, the contacts. Came back 2 years later. We fixed it. It opened up. We said, we'll just fix it for free for you. We'll redo it for you. But the teeth move. Your implant's not going to move. We had that big discussion. Yeah. And then like a couple months, he came back and he's all mad. This has been the problem since day one. And I'm like, dude, we fixed this for you for free like a couple years ago because he teeth moved. And it was never done right. I was like, all right, dude, whatever. We'll just fix it for you.
There's always the absolutes that patients bring in. It's like, this is the way it's been. Or actually, the fun thing when someone comes in with a total yuck mouth, like just trashed out mouth, right? And we all have had people have rougher lives than others. I can handle that. But then every single thing they have to tell you about their mouth is, and this dentist did this thing and he broke that tooth, and the dentist did this one, and that's why I have a cavity here because they messed that one up, and then this crown fell here because and then I'm like, no. The reason this is shit is because you have literal buildup that I can see from this far away when you smile. Like, when's the last time you brushed your teeth, buddy? Like
once a month.
once a month.
Between that, I use Mountain Dew to rinse off the bacteria.
Right. You got to wash the teeth off with, and not diet Mountain Dew, full sugar,
and then a little meth on the side to clean off the Mountain Dew.
Yeah, so. And then throwing a tobacco chew in the front to hang out with.
Dude, I'm so gullible. When I left school, I believed everything patients said. Like, oh, my old dentist ground down my bottom teeth. And I'm looking at them like, holy cow, they really did. And then you like years go on, you're like, dude, no dentist is grind teeth down that far. That was you.
You and doing this against your crowns for the last 20 years.
The crowns on top. So. Or my patient, or the whole knee to the chest, or that doctor broke my tooth doing this. It's
we have talked about that. It's like, physically speaking, knee on the chest just doesn't make sense. I might put an elbow on the chest, right, but not a knee.
I've done headlocks for sure.
Yeah.
Actually, that's sedation patient.
That's a good one when you especially have a sedated patient and you got their head keeps moving around, you got to reach around and
it works actually well. You just got to be careful who's in the room. So take a picture of that.
Yeah, you don't. Actually, we had this patient. I thought of who's in the room, and I went to parents or loved ones. Like when you're starting an IV, sometimes who let that patient? Who let the loved one back here?
Yeah, I do that all the time.
Why did we allow this happen?
Remember IV sedations? No one back here.
Yeah, as uncomfortable as possible it is for the patient or for the loved one to come back, because that just makes it uncomfortable for everybody.
Right. Yeah.
But anyway. So I have this 19-year-old gal back for summer break for college, and I remove her wisdom teeth. Ivy said everything goes smooth, but mom and dad are both over my shoulders as I'm starting this IV, right? It's their only daughter. She's 19.
Okay.
Okay, so she's about to really leave the nest, and mom and dad are helicoptering over me while I'm trying to do her sedation.
Yeah.
And so I get the IV started, first poke, luckily.
Yeah.
and then I start pushing the meds, and she starts to close her eyes, and I'm like, okay, she's good, go on, get out of here. And then she opens her eyes, I'm like, oh, she's still awake. And I'm like, get out of here.
She won't remember a thing.
Yeah, I'm like, I'm talking through. I'm like, just at this point, she's not going to remember anything. Just go ahead. And and so it we had to peel them out of the room.
Right.
Surgery goes great. Everything's smooth. And as she's leaving and coming to, she's your typical 19-year-old crying female, right? Just crying.
Yeah.
And mom and dad are just babying the heck out of her. Oh, sorry, just dad. Mom couldn't be there for the pickup. And I'm giving dad instructions, and he's writing it on his phone, detailed things wait, how much was that? And this and that. I'm like, bro, it's on the script. Just like go to the pharmacy. They'll
They'll take care of it. Actually, the pharmacist is better than I am at this stuff.
Yeah. I'm like, I don't even know what I wrote. So like, just go to the pharmacist.
Yeah, right.
But anyway, like making it way more detailed and lengthy while she's crying in our freaking hallway. Okay.
That's
I'm like,
awesome.
just get in the car, take this lady home. 2 hours later, you know, I got a call from mom and dad. She's still bleeding and they have to come in. Okay. She's still freaking out of it.
Yeah.
Bawling the whole time. They bring her into the operatory.
And you stick some gauze in there and like.
Yeah, I roll the gauze out and it's literally just drool, and the gauze are on her front teeth, not in where the wisdom teeth are.
Yeah.
And so I very respectfully was like, do you see where the gauze are in her mouth? They need to be farther back. And she's still out of it. So someone's got to put them in there and remind her to keep them there.
Right.
I was like, and all this, and I pull the gauze out like dripping with freaking saliva. I'm like, and this is all spit.
Yeah, this is not blood.
This is not blood.
Oh, man.
But oh yeah, just like a sobbing mess. And I'm like, parents, are you really this dumb?
Right.
Your daughter's on drugs. Tell her what to do and tell her to fall asleep. Like,
Yeah.
I said, because they're like, well, what do we do? When do we need to change the gauze out? I'm like, the best thing for you to do is take her home and let her take a nap for 2 hours with the gauze I put in her mouth. And then you can worry about it after that. Like, well, should we wake her up and change it in 30 minutes? I was like, take her home, put her to sleep. That's the best thing for her.
So funny.
Just like, and I was, man, I was trying to be nice, but it was like, they were one straw away from me snapping.
You're right. Like, come on, people. This is not that hard.
Yeah, it's not that hard. But it's their baby girl, their only one.
Yeah.
And being a father of multiple kids. And I'm not saying that people with one kid is wrong. I'm just saying, as you know, as a father of multiple children, it's like you kind of quit caring to a certain extent as long as they just like make it through the day.
Yeah. That's why usually your youngest kid is usually the best.
Yeah. Because
I think as far as like through life, yeah, they're like, my mom gave up on me, so I'm normal. They stopped crying.
Yeah. Tucker's got the best life.
That's right. Yeah, you get away with everything.
His older sisters are just a mess, and all he's got to do is like love his mom, and he gets away with anything he wants.
Yeah. Or you have my brother Chad right in front of me, and then it's like, dude, Chase is angel boy. Yeah, I am.
The best kid you could ever hope for.
That's right. He's got to follow up Chad, and then it's like, man, this kid's awesome.
That's funny.
I thought too. That's funny. I don't know how you can be, because I think one of the worst dental professions would be a pediatric dentist.
Yeah.
Not because the kids, but because the moms or dads.
Oh, it's the parents.
Yeah. They can be so rough. I'm glad our practice don't see many of them.
Yeah, we so I did a year. I don't know if I mentioned that on this podcast. Yeah, I did a year in pediatrics, or like 7-8 months in pediatrics before I came and worked for you.
Right.
2 things I didn't anticipate: how hard parents are to deal with in the operatory. Like, a kid is 1,000 times better if mom and dad aren't in there.
Yeah.
Like, every time, hands down. They could be the worst kid in the world. If mom and dad aren't in there, they're way better. And then 2, I didn't anticipate seeing as many nipples in the dental office as I did. I worked in a you heard me right.
We're really pushing the TVMA.
It'll come full circle. Just wait. I worked in a pediatric Medicaid practice, and whether it was moms nursing without shirts on, basically, or shirts with holes in them and no bras, like it was a daily occurrence, and they're not the ones you want to see, right?
Where is this going right now?
So you think you're talking about pediatric? It reminded me of it. So that's the
I'm never bringing this up again, guys.
There's zero value in this at all besides laughing and thinking about what patients do.
Oh, man.
And so it was like I 100% was like caught off guard the first time. By the 10th time, you're just like, yeah, it's part of my day. Let's keep on keeping on.
Just another day.
Just another day in paradise.
That's like when we talk about sedations and when they're going wrong. To us, it's just like, oh, well, okay, we'll work through this. And it's people around us that we worry about the most. It's like, oh my gosh, people are thinking we're not doing it right.
Well, that's you and I talked about that, I think, a couple podcasts ago. Is like, I'm worried about what everyone else is feeling, how they're doing. I'm like, she's fine. Everything's going good. We're just working through it, right?
Yeah.
And really, it's just like, can we just acknowledge that this is normal. We're working through it, and like I don't have to tell you this whole time so that I can think.
Right. So we can just take care of the patient.
Yeah.
That's so true.
Well, anyway,
Now we talked about nipples.
Yeah.
Let's close.
Why not?
Close this one up, and hopefully you're not seeing that many in your dental practice.
Unless you want to.
I don't, okay. Well, big gulps, huh? Well, see you later.
Yeah. Thanks for watching the podcast. Talk to you later. Bye.
Yeah, so I think there's some funny experiences. If you have any, share them on our Instagram page or YouTube comments, and we'll bring up next time, because patients can be a pain in the butt, and sometimes we just have to laugh behind their backs because that's how we deal with our stress.
We're not laughing at them; we're laughing behind their backs.
Yes, exactly. We can't say much. We're still professionals for the most part, but boy, we can laugh behind them.
Yeah. Yeah, I guess what we can do is you guys give us some funny things that happen in your chairs, and Chase and I will do another episode of Did That Just Happen?
Yeah,
and we'll talk about like the funny things people actually do in our chairs.
Yeah, dude, there's some funny ones. I think I still told someone that. Oh, we talked about this already. Did we talk about the lady that pooped herself in my practice?
Yeah.
I was there on my not my clinical day, and she pooped herself. Did I talk about the podcast?
I don't know if we made it to the podcast, but you told me for sure.
What in the world? I'm in the doctor's office talking to the doctor, and my hygienist comes in and says, "I don't know if I get paid enough for this." And I was like, what do you mean? And she says, "My patient just pooped herself." She says she walked in the operatory and lifted up her leg and said, "Oh no, look what I've done." It's poop rolled down her leg onto her socks and shoes onto our floor. Oh man. Poor lady. So my team's amazing. So one runs to the stores and get her like some new pants and diapers, and then my other hygienist used to be a medical assistant, so he went and gloved up and cleaned her all up. And
yeah, he's done this before.
I was like, yeah. He's like, "This is not a thing." I'm like, "Oh, dude, I'm out here." And my hygienist's like, "I'm gonna puke." What's the crazy thing is they still saw the patient. They like cleaned her up, and Juan's like, "Well, I don't care. I can smell poop," and cleaned her teeth and everything. I was like, "You guys are awesome."
I'll work through this.
Just work through right to it. So now
Juan's like, it's double hygiene. I'll be out here in 10 minutes.
Yeah, that's right. I'll be a little quicker on this one. So, anyways, so if that's the worst thing that happened to you, that's all right.
Yeah.
Patient pooped your pants.
That's
All right, we'll wrap this up before we get into trouble. But
yeah. Okay. Well, thank you all for listening. Not a lot of useful content, but funny content. And do that whole thing where you like, share, and follow, and all that stuff. We like that.
Go cheer on those Buckeyes.
If you want them to win. If you don't, there's
cheer for them anyways. I will disown you. I will delete you.
Tell you what, you text me the score, and I will say yes or no, depending on who's winning.
That's right. All right, guys. Thanks for joining.
Thanks, everybody. Talk to you later.
Thanks for listening to The Dentist Show. We hope that this episode helped you make smiles about more than teeth. To get more resources to grow as a dentist and to learn more about Chase and Ryan, go to thedentistshow.com or just follow the link in the show notes. If you enjoyed this episode, share with another dentist in your life and help us grow the movement. And be sure to rate and review wherever you're listening.